Good evening, Los Angeles. I hope this evening finds you and your families well. Let me cut to the chase. I know yesterday a lot of people felt very depressed. They saw and heard coverage in the news that implied that somehow for the next 3 months, Los Angeles County would be on lockdown. I know my phone blew up as people wrote to me and texted me and called me and said, "What does this mean? What did the county just say?" We are so lucky to live in a county with such professional public health officials, people like Dr. Ferrer and her team, people who are working around the clock to save lives. And it is the job of public health officials, from Dr. Fauci at the national level to Dr. Ferrer here in Los Angeles, to tell us the news and to tell it straight. It's the job of those of us who are lucky enough to be your elected representatives to make tough calls based on that advice, to make sure that we interpret the data, share with you the information, and walk you through how we make decisions. And I want to say 2 things. One is no, Los Angeles County is not going to be on lockdown for 3 months. Look at this past week and this week, and brave steps forward. This hasn't been a week of retreat. We've had to make tough calls, but based on the advice of our public health officials and people out there who are suffering, to take steps forward, to do things like opening up our trails this weekend, to get some of our stores back in business with curbside and doorside pickup, and to allow us today to go even further. Today was a great day for Los Angeles as people went back to our iconic beaches. And thank you to everybody who is taking part in opening up our beaches in a safe way to get us back to those places that fill our souls, that remind us of what's so beautiful here in Los Angeles, and give us hope for the steps and the days ahead. As I've been saying, we're not moving beyond COVID-19. We're learning how to live with it. The threat is just as great today as it was the first day that COVID-19 and this novel coronavirus landed in LA. And that means that it's not up to elected officials or appointed officials. It's up to all of us to care for one another, to care for our collective health and the health of our economy. And certainly I have tremendous hope in the days ahead that we can continue taking steps together, all the cities of this county, the county, together with our region, to make sure that we are managing saving lives and building hope back into this amazing city of angels. So no, we won't be shut down for 3 more months. That's not what I heard. That's not what I expect. That's not what I hope. And as I said, we're learning more about this virus every single day. It's teaching us lessons we wish we didn't have to learn, but lessons that are helping us, whether it's been construction trades or whether it's been our farmers markets, now our retail and golf courses and recreation, our beaches today and more, of the ways that we can carve back a life that gives us that spiritual nourishment that we need, that gives us the material prosperity that so many of us miss, and give us hope that our economy and our health can both recover in the days ahead. And depending on the public health conditions of the city, we will continue to adjust the order. There will need to be a public health order in place till we're done with this. In fact, every country that is so-called open and every state that is so-called open have public health orders. Ours is just called Safer at Home, but that doesn't mean that there'll be a full lockdown. There never has been, and moving forward, hopefully there'll be less and less of that. There might be moments when we see the numbers go up. We'll have to make the tough calls, do what's responsible, and save lives. But if we're all in this together and figure out smart ways that this virus is teaching us to get through living with it safely, we will continue to see forward progress. It's a process. It's not about a date certain. It's not about one date, as I've always said, where the light switch is flipped on. This is about a series of circuit breakers that we're already starting to flip on to see more light in what has been very dark days. But we also can't jump too far ahead. So our updated order doesn't have a specific end date, not because, and I want to say it again, everybody's locked down forever. It's because we still need to take the guidance of our public health professionals. We can't stop physical distancing, so we need to have that in an order. We can't take off those facial coverings, so that needs to be in an order. We have to not just say we care about our nurses and our doctors and our medical professionals. We need to make sure we are protecting them, and that's in the order. Our vulnerable populations, like our seniors, people with underlying medical conditions, we're going to have to be extra careful with them so that they don't die disproportionately. That needs to be in an order. So that's all that was said, is that the order will continue to be out there, but we will continue to intelligently and with the input of all Angelenos and all industries look at ways that we can continue to modify that safely and take steps forward. The city and the county have a roadmap. After today's new orders, our next steps are to keep monitoring public health conditions. It takes about 3 weeks to see the impact, probably about 4 to 6 weeks to really understand the full cycle of whether people get infected, reinfect others, and whether deaths start to go up. This is really tough work. And I want to remind you, this is about saving the lives of people we know. It pisses me off when I hear people saying, oh, those are just old people. Did you know that so many of the people that are dying are our parents and our grandparents and our neighbors? Many of them are veterans who have served our country. And even if they have fewer years left on their calendar than some of us, each one of those years is precious. When I hear people say, throw everything open, and then I talk to nurses who are saying, we are still scared to death. Some of us aren't even going home because we work in emergency rooms and we haven't seen our kids in weeks and months. Remember them, please. And let that inform you when you are about to run off without the mask that's sitting there by your front door. When you're thinking, oh, maybe I can skirt the rules and nobody will see. This is about our collective caring and our collective health together.